Good morning, friends. Today we will discuss about drugs used in treatment of vomiting or emesis, also called anti-emetics. Vomiting is a complex series of integrated events culminating in the forceful expulsion of gastric content through the mouth. The question arises why vomiting can be valuable, life saving, and physiological response. Vomiting is an adaptive behavior that can work to eliminate toxic substances that have been ingested. So, what are the consequences of vomiting if severe? Because of vomiting, dehydration takes place, imbalance between acid and base, electrolyte depletion, aspiration, and pneumonia. So, what are the causes of vomiting? Nausea and vomiting may be manifesting of many conditions and diseases. Vomiting center respond to input from higher cortical center stimulation, that is in the CNS. That stimulation is because of emotional factor, nauseating smells, thoughts, sights, or pain. Second one is disturbance of vestibular system, that is also called as motion sickness. Involvement of H1 and M1 receptor. H1 is different than H2, which we will take in the next lecture. Third response for vomiting is the periphery, that is pharynx and GIT via sensory nerve. GIT irritation, myocardial infarction, renal or biliary stones responsible for vomiting. Fourth cause of vomiting is chemoreceptor trigger zone stimulation, that is CTZ stimulation. CTZ is an area of medulla that communicate with vomiting center to initiate vomiting. CTZ is physiologically outside blood-brain barrier. CTZ contain involvement of D2 receptor, 5-HT receptor, opioid receptor, and substance P. CTZ stimulated by emetogenic drugs like opioid, general anesthetics, digitalis, and levodopa. Chemicals and toxins that present in blood and cerebrospinal fluid. Radiation and uremia also stimulate CTZ. Vomiting center is in medulla, which receive all the vomiting stimuli signals. So chemicals transmitted and receptor involved in vomiting includes acetylcholine, which act on muscarinic receptor, dopamine D2 receptor, histamine H1 receptor, serotonin 5-HT3 receptor, substance P, neurokinin receptor or NK1 receptor, opioid receptor. So classification of anti-emetic drugs based upon the involvement of receptor. The first class is 5-HT3 antagonist. Second category include dopamine D2 receptor antagonist. Third, NK1 antagonist, that is neurokinin receptor 1 antagonist. Fourth, histamine H1 receptor antagonist. 5. Muscarinic receptor antagonist. Fifth one, so sixth one, cannabinoids, and last glucocorticoids. These are the agents used as anti-emetics. So examples of drugs that included in 5-HT3 antagonist that contain ondansetron, granisetron. Pharmacodynamic and kinetic of 5-HT3 antagonist. They are orally or parenterally available, have long duration of action with first pass effect while administered orally. The most potent anti-emetic drugs act by blocking 5-HT3 receptor centrally in omitting center, CTZ, and peripherally 5-HT3 receptor on GI vagal afferents. So uses of 5-HT3 antagonists like ondansetron and granisetron. First choice for prevention of moderate to severe emesis. Their effect is augmented by combination with corticosteroids and neurokinin 1 receptor antagonist. Post radiation nausea and vomiting. Post operative nausea and vomiting. Chemotherapy induced nausea and vomiting, especially cisplatin induced nausea and vomiting. So certain side effects associated with 5-HT3 antagonist. They are well tolerated. Headache, dizziness, constipation with minor alteration in ECG, specifically QT interval prolongation. Second category, D2 receptor antagonist. Their types includes prokinetic drugs, means drugs that increase kinesis, means increase GI motility and gastric emptying time. Second type is neuroleptic, that are called antipsychotics. Drugs include in D2 receptor antagonist are domperidone, available orally, metoclopramide, available orally as well as parenterally, are prokinetic drugs. In neuroleptic, chlorpromazine and droperidol. Mechanism of action of D2 receptor antagonist. They block D2 dopamine receptor in the CTZ. Uses of D2 receptor antagonist. Use as anti-emetic by blocking D2 receptor in CTZ. Effective against vomiting due to cytotoxic drug. Gastroenteritis, surgery, toxins, uremia and radiation. Prokinetic, that is 5-HT4 agonist activity. Gastroesophageal reflux disease, that is GERD. Gastroparesis means impaired gastric emptying after surgery, and diabetes. These are the uses of prokinetic drug. The neuroleptic are already discussed in antipsychotic. They are used in post-operative vomiting and chemotherapy-induced emesis. Side effect associated with D2 receptor antagonist. Prokinetic agents possess dyskinesia, extrapyramidal side effect, galactorrhea, menstrual disorders, impotence, postural hypotension, specifically by blocking alpha receptor, sedation, and drowsiness. So, neuroleptic possess extrapyramidal side effect, sedation, and postural hypotension. In prokinetic, metoclopramide cross blood-brain barrier, but domperidone cannot. Both have anti-emetic effect as CTZ has incomplete blood-brain barrier. Neurokinin receptor antagonist. So drugs involved in NK1 receptor antagonist are aprepitant, pluripotent. Mechanism of action of NK1 receptor antagonist. They act centrally as substance P antagonist by blocking neurokinin 1 receptor in vagal afferent fibers in STN and area posterma, usually combined with 5-HT3 antagonist and corticosteroid in prevention of chemotherapy induced nausea and vomiting and post operative nausea and vomiting, better used in combination. Next category includes H1 receptor antagonist. So drugs are diphenhydramine, promethazine, meclizine, cyclizine. Uses of H1 receptor antagonist, they are used in treatment of motion sickness, morning sickness in pregnancy. Promethazine use in severe morning sickness of pregnancy, can be used to treat extrapyramidal side effects, especially diphenhydramine. Side effects associated with NK1 receptor antagonist are prominent sedation, hypotension, anticholinergic effect or atropine like action, means dryness of mouth, dilated pupil, urinary retention, and constipation. Next category, muscarinin receptor antagonist. Drugs are hyoscine or scopolamine. They are orally as well as parenterally available, also available in the form of patches. Patches used in motion sickness before journey by 3 to 4 hours as an prophylactic agent. Uses: transdermal patches are used in motion sickness, reduce impulse from vestibular apparatus. Side effects associated with scopolamine are sedation, tachycardia, blurred vision, dryness of mouth, constipation, urinary retention, that is atropine like action. Next category is glucocorticoids like dexamethasone and methylprednisolone. They are used in chemotherapy induced vomiting, treatment of asthma, immune disease during transplantation, and anti-emetics. They are used as an anti-emetic in combination with 5-HT3 antagonist or NK receptor 1 antagonist. Side effect associated with glucocorticoids: hyperglycemia, hypertension, cataract, osteoporosis, increased intraocular pressure, increased susceptibility to infection, increased appetite, obesity, increased body weight. So these are the common side effects associated with glucocorticoid treatment. So the choice of antiemetic depend upon its etiology. So motion sickness means involvement of muscarinic and histaminic receptor, so that can be treated by muscarinic antagonist and antihistaminics. Omitting with pregnancy, that is morning sickness, can be avoided by use of pyridoxine, that is vitamin B6, and promethazine in late pregnancy. Drugs induce ometic, uremia, gastritis, or post-surgery ometic involvement of D2 receptor, so dopamine antagonists are preferred. Post-operative nausea and vomiting, again dopamine antagonists are used in post-operative nausea and vomiting. And last one is vomiting due to cytotoxic drugs, that is chemotherapy induced nausea and vomiting. So use of 5-HT3 antagonist, neurokinin 1 receptor antagonist, dopamine D2 receptor antagonist, and glucocorticoids. So thank you for watching Anti-emetic drugs. You are listening to Dr. Vijay Navgare. Thank you. Have a good day. Stay home, stay safe.